Hey everybody, it's Dr. Dave. Thanks for being here today. Thanks for joining me on my YouTube channel. This is the video about how this whole thing happened. I never set out to be a YouTuber. I guess that's what they call people like me now. It was not an ambition of mine, but I've always been frustrated that I only got to talk to one person at a time. It's always frustrated me that in my office, if you come to my office, I'm very happy that I'm able to see you. But there might be 10 or 100 or 1,000 or 10,000 or a million of you not in that chair at that moment that I can't help. I didn't know what to do about it at the start. Back in the 90s, I wrote a book proposal. It was pretty quickly rejected. I didn't do a lot about that until about 3 or 4 years ago. And I wrote a book. And I wrote a book based on my 30 years of experience as a psychiatrist. What I had done as an outpatient doctor, I've never worked in a hospital. I've always considered my job to keep people out of the hospital and working with what sometimes are referred to as the walking wounded, the people that they need treatment, but they don't have to be psychiatrically hospitalized, but they need medicines for brain chemistry problems, depression, anxiety, attention deficit disorder. And in treating those conditions, I was always shocked by the fact that, in fact, even today, I've never had a patient walk in and say this. If I ask, hey, why do you take Zoloft, for example? I've never had a single patient say, well, that's because I have a serotonin shortage and that's my serotonin booster. So since I've never had someone say that to me so clearly, I've always known that that statement has not been taught. So I wanted to teach it to people. And the truth is, I teach people one at a time. Sometimes 2 at a time if I've got a family member, a spouse who watches this whole thing and says something like, wow, you mean the reason that they're depressed and no interest and can't get out of bed is because they have low serotonin and you're just going to push up their serotonin and that's it? They're not crazy. They're not mental. You're just going to do that? The answer is, yeah, that's what I'm going to do. And then we do it and they come back and say, Doc, you're right. And we've got it. We've solved that and we just keep them on the medicine as long as we need to. And that works. But that's a one at a time thing. So my frustration was, if I'm teaching 1 or 2 people at a time, how can I do better? Well, I wrote the book, and the book was about these concepts. And some people said, people don't really buy books anymore. It's really if you want to reach people, writing a book's not the best way to do it. And I thought, I'm 63, so I'm a little old school. And I'm thinking, yeah, I want to write a book. That's important. Write a book. That's credibility. So I reached out with my entire book written. It wasn't edited. It wasn't finalized. It wasn't polished. But I reached out to a person who helped me get it promoted. And I said, okay, well, how do we get this book promoted and sold? And, get it in people's hands. And she said, well, the first thing is to get you on television shows and talk about how controversial you are. I said, what are you talking about? She said, well, you have to get noticed. The way to get noticed is to make controversial statements. And I'm not sure she was actually right on this, but really what happened was I realized at that point that I'm really pushing too hard on something that's just not going to work. And I took my book and I put it in a box and I taped it up and I set it in the attic. And then through a completely unrelated experience, through music actually, I reached out to a guy, sent an email to a guy who you might already know as a YouTube superstar. His name is Rick Beato. And I sent him an email about an experience I'd had musically. And he was nice enough to respond to me. It was amazing. He just called me up and said, hey, let's talk on FaceTime. So we talked. And after speaking to him, he obviously interviewed me a little bit about what I do. And I got the sense that maybe I'd met him for a reason. So as I got to know him a little bit better, and I only have personally met with him once, but in my personal meeting with him, basically the proposition was, Rick, do you think that YouTube would be a vehicle for me to reach people that get them the information that I want them to have? And he said, oh, absolutely. And I said, better than a book? He said, no question, absolutely. And so basically, he said, yeah, you can do it. And I said, okay, I'm going to try to do it. So we're here. I am in my office studio, but I really feel in my heart this is a way to reach people. And I really think it's great that wherever you're at, wherever you are in your journey, if you are in treatment, If you're thinking about getting in treatment, if you have a friend or family member you're worried about, I hope this is a channel that you come to, that you explore the content here, and that you get value from it. Just a little about myself. Briefly, I'm a private practice psychiatrist. I've been a board certified psychiatrist for 30 years. I graduated Stanford University in 1982, went to medical school. Initially thought I was going to be a surgeon, trained in surgery for full year internship, and prior to that, 2 years in medical school. And so that's why I have the surgery book on the wall here. I really felt that surgery was ultimately was the wrong path for me. Because I had other interests, and to be a surgeon, I really think to be a really good surgeon, you have to be very laser focused on surgery only. I'm into lots of things, and I really felt it was surgery wasn't actually the best choice for me. So I got out and I switched into psychiatry. And a lot of people at the time asked me, why would you go from something like surgery to psychiatry? You're going from the operating room to the couch. Well, no. I don't have a couch. And I have the surgical mentality. And I think if anything, I can encourage you, if you're a prescription writer out there, or you're coaching your prescription writer, it's okay to be aggressive. Surgeons are aggressive. They have a bias towards action. Psychiatrists, I think sometimes we get the reputation for, we sit and we ask questions, and how are you feeling? And how do you feel about that? And that's, sort of the standard joke about the best thing a psychiatrist can do is ask you how you feel about some problem. Well, I think somebody who's got a prescription in hand and they're legally allowed to write prescriptions for you, whether or not they're a psychiatrist, bias toward action is what we need in today's world of so-called mental health. There's one way to approach mental health, which is be aware of it, which I don't think really works very well. Honestly, in 30 years of being a psychiatrist, we haven't fixed that problem. Mental health awareness hasn't fixed that problem. What fixes the problem is saying, this isn't mental, this is medical. Let's take action. Let's do something right now and see if it works. And if it doesn't work, let's do something else. So I think my surgical background really does bring a lot to the table here. And I hope to share that with you, and I hope to share that aggressive spirit with you, so that if you're asking for help, be aggressive, self-advocate. If you're a prescriber, be courageous, do the right thing when it's easier sometimes to just say, oh, we don't want to talk about that. Do the right thing. As an outpatient psychiatrist, my job for the last 30 years has been to keep people out of the hospital. I wasn't really trained in this method of what I call troubleshooting brain chemistry. It's sort of, I know other people do it. I think I put a name on it, but it's the method of being able to say, fix one problem, see if it fixes it. If it doesn't, do the next thing, do the next thing, do the next thing. Instead of saying, here, take some medicines and I hope you feel better. That really was born out of me not really having a supervisor for the last 30 years. I was able to do what I wanted. And the reason I kept doing is it works. I think sometimes people get the idea that I do this because I make more money because I write prescriptions, and that somehow I'm connected to the pharmaceutical industry. I am not. I don't make any money from pharmaceutical companies. I'm not sponsored by pharmaceutical companies. I don't make extra money by writing prescriptions. I get paid for my service, which is trying to figure out what people need, and I do that. But this is not about trying to get people on drugs to medicate people. It's not about trying to medicate people. This is about identifying a medical problem and fixing that with the tools that I have, which is today, it's medication prescriptions instead of a scalpel. So that's a little bit about my background. And I'm really happy that Rick encouraged me to do this. He's a genuine guy. He's a great musician. He's wonderfully talented. And I credit him with helping me do this YouTube channel. So for all the rest of you, thanks for being here today. And thanks for coming to see me.